Family. Whatever you need, they've got your back. Like MemorialCare Health System, a family of healthcare providers. At MemorialCare, we're all connected. The finest hospitals like Saddleback Memorial, top doctors, medical groups, urgent care centers, in-store clinics, and more. No matter which one of us you visit, we're all up to date. We can keep you healthy and care for you when you're not, right in your own backyard. The family of MemorialCare Health System, investing in you.
All right, joining me now is young Trinh, a doctor from Saddleback Memorial. Now, doctor, we were just talking about some of the work you do, and it's just something that a lot of people don't know about. You know, it can heal so much, it can do so much, but people just aren't aware that it's an option. And so tell me about this. This is some of the things you do is acupuncture that can help people in so many ways that they don't know about.
Yes, thank you. Acupuncture is an Eastern medicine technique that originally started in Asia, but is now pretty much accepted in Western medicine. As a general internist and geriatrician, the majority of my patients, I do practice mainly general internal medicine, but I have over the years integrated acupuncture as part of the treatment program for a lot of our patients. The benefits of acupuncture, I've noticed, is that you know, if you can take less pills and less medications and get better health through acupuncture, it's a better natural technique.
Yeah, you know, I think people see acupuncture and they think it's just some silly thing that, you know, just some crazy people do just to make them feel good mentally. But I think that's the thing, that this goes back historically, so it goes back a long way, and there's some medical effects from putting a needle into someone's arm that isn't just mentally, it actually does things that can help them.
That's correct. Acupuncture 20 years ago would be looked on as some hocus pocus type treatment. But over the years, what we've seen, especially through Western medicine, is that we have now conducted multiple clinical trials and clinical studies using, you know, randomized techniques to show the effectiveness of acupuncture through Western medicine. And as a result of that, physicians are now actually learning acupuncture. I got my acupuncture training at UCLA with that, and as more clinical studies come out, it's become a natural, accepted technique now in Western medicine.
It is. Well, tell me, you know, I've seen it, I know what it is, but how could something like that work? If you take a needle and you put it somewhere, what possibly, how could you get any effect from that?
Yeah, what we have seen and what we have actually measured through studies is that acupuncture, by the placement of needles through specific parts of your body, can stimulate the body's response. It increases certain chemicals in the body. For example, it can increase endorphins. Many folks have heard of endorphins, which is the body's own natural painkillers. Increases enkephalins, dynorphins, serotonin, some different chemicals that will stimulate the body to basically heal itself and bring the body back to balance with that. And that's been documented and studied.
So when they put the needle in, you don't feel anything, but your body just tries to heal it, and so it shoots the things to the, is that how it works?
There's two, there's an Eastern explanation, and then there's an actual Western explanation of how acupuncture works. Now, in the Eastern Chinese explanation, what happens is that your body has channels of energy that runs through your body, and have you heard of qi energy? It's, qi is the name of an energy flow that runs through your body, through particular channels throughout your body. And so disease or pain is described as the blockage or the stagnation of that qi flow in these channels. So let's say if my, my arm hurts or my leg hurts, it may be that the qi flow running through the arm or leg channel is blocked. In the Eastern explanation, what we do is we by the placement of acupuncture needles in particular areas of the body, we unblock these channels to improve the energy flow through them, and that promotes health and healing. That's the Eastern explanation. In the Western explanation, we've shown basically through clinical trials that we can innervate certain areas of the nervous system to either affect pain or to affect inflammation and improve on that.
Well, when you're taking these tiny needles and sticking them somewhere in the body, is there any possibility of a complication of accidentally hitting the wrong nerve or going into a vein or causing a problem that's worse than before?
Yeah, there's, as with any technique or procedure, there's always a potential for complications, although it's extremely rare in acupuncture. The needles that we use in the office, first of all, we only use them once and then we dispose of them. But the ends of the needles are actually not sharp ends. They're, if you look at them under a microscope, they're rounded ends. So there's less chance for any particular complications, such as hitting a nerve or things of that sort.
Okay. Well, so basically you're taking these needles and you're putting them in parts of the body, and what does the body do when it feels this needle is being put in? What's the body's first reaction?
If the question that I hear often is, what is under that acupuncture? What does it look like under the skin where that acupuncture needle probes in? And we've actually studied that under anatomy, where we would look at the areas, the acupuncture points under the skin, and have found that the area where these acupuncture points are, they're very specific. Under that area is what's called a neurovascular bundle. It's a bundle of nerve and blood vessels that are concentrated under these acupuncture areas. And so we've learned that these particular acupuncture points is essentially a connection with these neurovascular bundles where specific hormones and neurotransmitters and proteins can be released and carried to other parts of the body.
Well, if I'm like a little scared of something like this, and I think I want to go to my regular doctor, I just want to get a regular surgery, I don't want to deal with this, is there somewhere in between where you could possibly have just a little bit of the acupuncture, a little bit of the regular doctor surgery? Or
oh, definitely. We integrate both. It's no longer, in my view, an alternative type medicine, but it's integrative medicine. So for example, patients with chronic pain, back pain, neck pain, arthritis, they go to their orthopedic docs, and they also come to me for treatment with the goal of cutting down on the amount of pain pills, the amount of Vicodins or narcotics they have to use, and hopefully through a number of cases preventing surgeries with that.
So instead of taking a pain pill, by doing the acupuncture and putting the needle in there, the body creates its own pain pill. Its own
endorphins.
Okay.
That's right.
And so, yeah, so you're not getting this extra drug in your body. Your body's just creating this new drug.
That's the goal, is to take care of your body naturally.
Naturally.
With that.
It's just an amazing thing. Well, let's see. I guess the final question is, if someone, say, is interested, if someone has tried lots of different medicines and doctors, and this is something else they'd like to try, what should they do?
Yeah, they could certainly seek out a certified or professional acupuncturist. They're welcome to call our office as well with that, and we'll be glad to see them.
Okay, well, I see the phone number here is 1-800-MEMORIAL, and Doctor, you're Dr. Young Trinh, and is that something they can just ask for you, or just?
They can ask for a consult, and we'll sit down and review their conditions and see if that's appropriate for them.
Okay. Well, thank you, Doctor. Our guest was Dr. Young Trinh, and he had some fascinating information about all the potential of the procedure of acupuncture. And so anyone out there that's tried all of the regular procedures, is looking for another possibility which could take away some of the pain and help in the healing. It's just fascinating. It's someone you should call. It's 1-800-MEMORIAL. And Doctor, thank you for being here. And we'll be back with more of your Channel 6 news coming up right after this.
Family. Whatever you need, they've got your back. Like MemorialCare Health System, a family of healthcare providers. At MemorialCare, we're all connected. The finest hospitals like Saddleback Memorial, top doctors, medical groups, urgent care centers, in-store clinics, and more. No matter which one of us you visit, we're all up to date. We can keep you healthy and care for you when you're not, right in your own backyard. The family of MemorialCare Health System, investing in you.